introduce the Acting Director of the Division of Extramural Research and Training. And Pat, take it away.
Do I have a microphone that works? First try. Well, welcome back to the second day of our council meeting. I hope whatever you all did last night, you had a good time. I didn't make it up to the rooftop bar, but I hear there was a contingency up there, so I hope everyone had a good time. As we typically do for every council, I'm going to give, typically give the director's report from Division of Extramural Research and Training. It's my pleasure to do that this round. Just a quick overview of the things I'm going to touch on. I'll be introducing some of the new DERT staff, take care of some business doing council delegated authorities, which I'll explain more later. Have a couple of concepts for Superfund that we'd like to get a vote on. Then I'll give a brief demonstration of the epidemiology resources web tool, a budgetary wrap-up of what we spent in FY19, and then a quick look at what we're planning on funding in 2020. And then we'll do some highlights of things that our staff have been involved with over the last several months, and then a little introduction of some things, upcoming meetings that you all might have some interest in, and then a couple announcements I think you will be interested in. Before I go too far, I want to recognize the staff from MDB, Megan and Lynn, for the work they did putting these slides together. The aesthetics of this belong entirely to them, and much of the content. So the first part is always the fun part, is introducing our new staff. We have two new recruits for the division, for the grants management branch. This is the group, of course, that gets all the awards out and does all the regulatory stuff, keeps us all out of jail. Our first recruit was Clark Phillips. Clark comes to us from USDA, where he was a grants management specialist there, working in a variety of programs related to agricultural and natural resources. He managed a portfolio in agricultural science, natural resource conservation, domestic farm programs, and he also worked on a working group about looking at enterprise solutions for the grant management there. Clark came well-tooled to help us out. We just had to teach him to transpose into biomedical, and he's doing very well. Our next GMS recruit is Alicia Heslop. I don't think either one of them are here today. Okay. Alicia actually comes to us from the National Institute of Neurological Diseases and Stroke, where she has some experience as a grants management specialist. So great to have someone who can kind of hit the ground running. She joined NAEHS in 2016, where she managed a portfolio for a number of mechanisms, as well as being a FOIA and the Federal Financial Conflict of Interest Coordinator. Prior to that, she was a paralegal for the Social Security Administration Appeals Court. So grants management is very pleased to have these two people in their midst now. The next person I want to talk about is Lindsay Martin, who is here today, I think, back in the corner over there. Lindsay's a medical anthropologist, comes to us from the Houston VA. Her specialty is qualitative research methods and community engagement and implementation research. While she was at the VA, she was the lead qualitative methodologist in the Methodology and Statistics Corps, and a faculty advisor to the Veterans Community Engagement Committee. She's joining Population Health Branch, and she'll be working in these areas, and these should sound familiar to you: social and behavioral science, community engaged research, implementation and dissemination, and environmental health disparities. She'll be kind of picking up the ball from where from Liz, Sima Finn's retirement, and so she'll be working with Liam on this, and we're very pleased to have you here. Looking forward. And finally, a face that is familiar to us is Yusha Chu. Yusha joined us in 2013 as a contractor working on the Trans NAEHS Exposome project concept, and was a coordinator for CHEER. But prior to that, she was a postdoc in DIR looking at off-target toxic effects of therapeutic drugs using toxicogenomics and DNA damage repair assays. But we have got her on board as a Fed. She's a federal employee now. We taught her the secret handshake and the whole thing, and so we're pleased to have her as a full-time staff. Now, her new focus will be the exposure science portfolio. She's also going to be a program officer on some of the CHEER network programs, and will be coordinating the Common Fund Metabolomics program that David has had us involved in. So welcome to all of them. I want to conduct a little business real quickly. Every year we have to bring to you what are called our council delegated authorities. And these are actions that are delegated by you all back to DIRT staff, and so we don't have to bring them back to you for further follow-up action. These are usually kind of small administrative grants actions, and the purpose is just to keep operations smooth so we don't have to bother you every 3 months, 3 times a year about this. And the kind of things that we're looking at, and these are in your council delegated authority documents in your ECB, are changes of institution. So if a PI at University X goes to University Y, they can take the grant with them, and we can do that without bringing that to you. Similarly, if a PI leaves a grant and it stays at the institution, we can put in a new PI. Similarly, if we have a situation where the PI needs to, for a short-term basis, step out of being PI, and the university wants to place somebody else in, we can do that. And then we have 2 situations where we might want to extend the grant either with or without funds. Again, these are fairly small administrative actions and not really worth the time to bring here for a vote. So we ask you to delegate the authority back to the DIRT staff. But I need a vote to do that. So if there are any questions about what I just said, we do this every February, I will ask for a vote to delegate these authorities to us. So I need a motion. Thank you. I need a second. Any discussion, questions about this? If not, I'll ask for a vote, and we're doing this electronically. And I'm looking at Liz over here on the corner. Okay. We'll give it another few minutes for people to vote here, because our next action is also requiring a vote. So I have to apologize. I'm coming up for the world's longest cold here, and my voice is not perfect. I apologize. All right. Oh. Yeah. So people, I guess, at the table here need to log in if you haven't. Everybody logged in, see what they're seeing. And I forgot to mention, Andy, you're on the line, correct? Andy?
I am, yes.
Without actually being here. Okay.
One of those environmental hazards that we have to work on here.
And Shugmei, are you on the line? Are you seeing Shugmei? Okay. All right, so we'll go ahead and please finish voting if you haven't done that. So, the next thing I'm going to do is to bring a couple of concepts to you. So, as with Chris did yesterday, we bring all of our new programs to council with a concept, and you approve it or not approve it. Hopefully you do. But then for standing programs, every 5 years or so, we try to bring these to council for your approval, for your update and your blessing to keep going forward. In some cases, when the programs are a continuation of what's been done before, only slightly tweaked, rather than have the program officer stand up here and give you a 20-minute presentation, then you vote, we bring these to you through this report time. And that's the case for these 2 SRP program plans. Two RFAs I want to mention today. This is a slide. The first one, do I have a slide there? Yeah, the first one we're going to talk about is the RO1 concept. This is a slide that Michelle Heacock showed you yesterday. And I'm going to focus down here on the remediation aspect of the SARA legislation. This is part of the program that is unique, I think, to all of NIH, certainly the NIHS, is environmental remediation, which, of course, the purpose is to reduce the amount and the toxicity of hazardous substances in the environment. This is part of the P42 program. I think every P42 program has a remediation part, but we've also been using this RO1 program to enhance the P42 remediation efforts. And we've been doing this since 2006 when we had our first RFA, and we have since done 5 of these RFAs. And the RFAs put an emphasis on application-oriented mechanistic research, but are also on technology-driven research. And the goal is to develop sustainable methods for remediation of hazardous chemicals in the environment. So over the years since the 2006 with those 5 RFAs, here are some of the successes that we have had. I won't go through these individually, they're in your material, but for instance, basic research leading to new solutions for sequestering mercury and PCBs in sediments, patents for biomimetic approaches to extract uranium from water, product lines for antibody-based PAH detection. And one that we'll continue to talk about here in a second is research focused on contributing to the natural bioremediation. So the environment can take care of itself to some extent, but we want to help it out. So we're looking at technologies that will aid that. And you see the double image there, or are my glasses having a problem? Okay, good. Great. Calling the medics here. Okay, and some of the conditions, so what we're trying to do is adjust geological and or geochemical conditions to improve how nature takes care of environmental chemicals. So in this new RFA, we want to continue that among other parts of the program. And I've got Heather's in the room, but I'm going to try to get through this. This left side is a photo from an SBIR grantee, Microview Biotechnologies, where they're dealing with microbial degradation of hazardous chemicals. We have a big program in that area. And what they're doing is they're developing an engineering platform that will reduce the rate-limiting bottlenecks of the process so that degradation can happen quickly using biocatalysts to enhance metabolism by the microbes. So that's what this is the kind of thing we're looking for in this upcoming RFA. This diagram is from Pedro Alvarez, and they're using above-ground radio frequency signals to release the toxic agents down here that are in situ. The image depicts the use of nanomaterials to enhance the thermal treatment and to decrease energy requirements for the bioremediation. Again, this is the kind of thing we're looking for. If you need a more precise and extensive description, I recommend you talk to Heather at the break. In terms of timelines, assuming approval today, the applications will be released shortly, hopefully this month. The review will happen sometime in the summer. I think what the new timeline is to take this to council in September for awards, probably in the winter rather than spring. These are a $200,000 direct cost limit for 5 years, and the number we'll fund depends on the budget that we have available. So with that, I'll stop and ask if there's any discussion, any questions about this program. I know I see Bill over here, he can probably, and Heather, so between the two of them, if there are any questions. If not, can I have a motion to approve this concept continuation of this program? Very successful program, thank you. A second, we have. Any further discussion or anything? So if not, I'll ask you to electronically vote to approve this concept to go forward. And again, I'm looking at Liz to see how the voting's going. Okay, great, thank you. So the second program I want to talk about is our R25 occupational and safety training education programs on emerging technologies. Referring back to this slide which I showed earlier, one of the things that is included in the SARA Act is, get my notes out here, is a mandate for training courses, such as short courses and continuing education courses for personnel who are going to be handling hazardous waste. We have released 2 RFAs in this area previously. These are for R25 mechanism, which are short-term training courses. We first rolled it out in 2012, and the purpose was to develop educational materials on environmental health and safety management practices for industrial hygienists and graduate students who will be involved in the evaluation, management, and handling of hazardous substances, focused in areas of emerging technologies such as emerging hazardous waste products, green chemistry, sustainable remediation, and detection technologies. The materials they produce could take the form of continuing education or courses for skills development, as well as academic curricula on this topic that could be given to industrial hygienists and graduate students, like I said. Here are some of the success stories from this program. And again, I'm not going to go through these in detail, but you can see some of the programs have been involved in green chemistry up at Washington, evaluation of wipe samples, but looking at e-waste recycling plants, looking for hazardous materials there, and looking at nanotechnology and a variety of different things. A program that's been very successful up until this point. So we would like to continue it, and in the new program we want to focus on the same skills development, curriculum, and methods development, but this time we're also adding research experiences. And all three of the areas will be required for every application, but you can shift the emphasis about which one you would want to do. And we're, in addition to the emerging technologies I mentioned before, we're also looking, which are listed here, we're also looking for grants in disaster response as well as laboratory practices such as global harmonization, control, banding, and a number of things as well. So this program timeline is we will release the RFA sometime in the spring. Excuse me. Review in the, I'm looking for in the fall to be released probably in the spring. We'll allocate up to $1.5 million for 6 programs for 5 years. So again, that was a very quick step through, but if there are any questions, I think Danielle, I think I've seen her, so she's way back in the corner. If you have questions, please ask. Yeah.
No questions, good morning, but highly supportive for the addition of the 2 other ones of disaster response and laboratory practices. Thank you.
Oh, good. Thank you. If no further questions, I will ask for a motion to approve this concept. We have that in a second. Any discussion? I will ask you then to vote electronically on this second concept. Okay, we're looking good. All right, thank you for doing that. The next thing I want to give is to talk about our NIH-funded epidemiology resources webpage. Gwen had hoped to talk about this at September Council, but the discussions of other things ran long, and so this fell off the page. The irony, most of you will know, is that Gwen is an epidemiologist and I'm not, but I've gone to this page and everything I tell you about how easy to use is true because I was able to use it. So what is the tool? It's a web-based tool for information about our environmental epidemiology studies that are funded by NIH. Each study is linked to one of our projects, our grants, that is supported through our extramural program. Each cohort is linked to it, I said that, that has supported the initial development of the cohort, added study participants, collected additional materials or samples from the participants, and or used samples or data sets derived from the cohort. And you'll see that you can look at a search by cohort or by grant level. At the cohort level, you can access information about health outcomes, exposures, cohort location, and description. At the grant level, you can find information on health outcomes, exposures, biological and environmental samples, and a variety of information, which I will show you in just a second. The goals of this program are shown here to facilitate new collaborations and data sharing in the environmental community to maximize our investments, as we talked about yesterday, about data science, get the most out of our data. And I thought this was an interesting one to provide junior investigators a path to initiate some ancillary studies without having to conduct the whole study from scratch. So there's been a series of updates lately that have made the tool easier to use and better looking. When you you'll see that as of last Friday when I looked, there were 72 population studies and study populations, and 236 funded grants or projects. There's a new filtering system, which I'll show you in just a second, and improved keyword search, and the new design, like I say, which is designed to make this look better. This is your landing page. If you go to this website URL, this is your landing page, and as you can see, you can browse all components within the tool, or you can look specifically at study populations, or you can browse at specific projects. So purpose of the demonstration, we're going to hit the Browse All button, and it'll take you to something that looks like this. And you see some information there. Here's the 72 study populations and 236 projects I mentioned. This drop-down menu is maybe I can see it better there, is where you can do your search. So let's pick at random, skin cancer and arsenic. If you click on the environmental exposure drop-down menu, and then on the, I can't see what that is, metals, and click arsenic, and then if you click on the, does that say health outcomes? The drop-down menu will drop down further, and you see cancer outcomes and skin cancer, and we click that. And when you do that, you'll show that the two filters you applied are arsenic and skin cancer here, and you'll see that there were 3 results. 1 is a study population, and 2 are the projects or grants. And these are indicated by these 2 icons that shows you whether you're looking at a project or a grant. If you click on that link there, it will open up this page here showing you what you just clicked on and a variety of details about the, this is the grant. I cannot read that at all from this angle, I'm sorry. Who the PI is, where the PI is, and a number of other things. I'm sorry, I can't read from this angle. But at any rate, as I say, it's a very easy and useful system, and I recommend if you haven't, you should go in and tool around, and there's a lot of good information. I want to acknowledge the people who did the work, Amy, Jenny, Takara, Kim, Bonnie, Helena, Claudia, and of course the cohort principal investigators who helped set this up, or who provided their data for setting this up. All right, the next part, notes. Historically, in February Council, we give a wrap-up of the budget from the previous fiscal year, so that's what we're going to do now. This chart here represents the totality of what we spent on grants last year. We spent $361 million. What is it they say, 100 million here, 100 million there, right? And as expected, the vast majority of what we funded were our research project grants. We spent $264 million. But we also, which represented almost 3/4 of our expenditures, we also spent 10% in our research centers, 4% in our training line, 7% in our other research line, which I'll kind of go into these a little bit more in a minute, and then our small business line, we represented about 5% of our total budget. So right now I'm going to focus on just this wedge of the pie, the research project grants. So this whole chart represents just the RPGs. And not surprisingly, the largest part of RPGs are our R01s at $190 million. We also funded $19 million in R21s, $16 million in U01s, and then $10 million in R35s. This is our river program, which you have heard about in previous rounds, and then $26 million with our other RPG-type grants. Now, this circle diagram here also represents RPGs, but what we're looking at here is competing versus non-competing. For those who aren't familiar, competing grants are new grants or grants that have come back in for a continuing renewal. Non-competing grants are what we call our type 5s, or our out-year grants. So these are paid to grants in the 2nd, 3rd, 4th, 5th year or whatever. And as typical, we fund about 3/4 of our funding goes to paying the out years or the non-competing awards, and about 1/4, in this case, $62 million, go toward paying our competing grants. This is looking at the competing grants that were funded through an RFA, so our solicited grants. We funded a total of about $17.6 million, and just stepping through these quickly, the river, our population-based model organisms research RFA, which I mentioned briefly yesterday, our WONS awards, which are for early investigators, and our Victor awards, which is for hooking researchers together to do translational research, a new program, which was the Microbiome in Developmental Origins of Health and Disease program, and of course the time-sensitive R21s, which we have been doing for several years now. And then a new program, which we started with National Institute of Aging on telomeres in health exposures and stress and disease. Sorry, the screen is jumping there. So these were all things that we set aside funds for and supported last fiscal year. So those were all RPG solicited. I'm going to move over to the that wedge there, which is the other line. So we put a big investment in our other research line in the form of the HERE program, which showing here is about $8 million. There's more that I'll talk about in a minute. And then we also, you heard about the cohort maintenance program yesterday. We've spent $4 million, a little over $4 million last year in that. Sorry, let me get my notes out. This represents something of a change in philosophy for us by putting a fairly large investment into programs that will facilitate or support research rather than giving it for the direct research. So this is something we've talked about at council before, and this, setting up and supporting research, supporting projects. All right, I'm going to slip back to the RPG line a little bit and look at some historical data. What you're seeing here are solicited and unsolicited, both combined, competing research projects. And so over the last 3 years, these are the number of awards that we have made in that line. You'll see that FY19 was lower than FY18. This is mostly because of the money we moved over into the other line to cover the HERE and cohort maintenance. But again, we still are funding meritorious grants in this area. This is showing the same data a little bit differently, broken down into was within our pay line and what we paid in raise to pays. These are our pay line was set at 10%. We have a procedure for identifying meritorious applications above the 10%. We have a number of conditions and considerations we put into that discussion. So you can see, again, what's missing up here is the raise to pays that were, again, partially due to the movement of some of this money over into the other research line. Okay, and now I want to I'll go into a little detail about the non-RPG extramural awards. We have, as I mentioned before, there's the graph we had earlier. We had spent about, whatever that number is, $36.6 million in our centers lines. That's predominantly our P30s and some P50s. Our training line consists of institutional as well as fellowship grants for training. That was about 15.6, I think. Our other line contains two components. One, well, I'll start here. One is our career grants, K01s, K99s, and so on, career development grants, and another part that is basically everything else. And that includes, for instance, our conference grants, but also our cohort maintenance grants and our HERE grants show up over here. And then our small business line, we spent $19 million in, and you can see how the breakdown is there. Let's see what I've got next. The next thing I'm going to talk about is our Superfund budget, but I want to stop there. I went through a lot of data fairly quickly there. Are there any questions about anything I put up there? Any data, the graphs? It's a lot of data for first thing in the morning. Yeah, Jose.
So Pat, with all this data you're presenting, I remember at the last council meeting we talked about the potential of reducing the pay line to have more flexibility with these solicited awards and rates. How is the pay line now compared to, let's say, because we had that discussion and there were people with conflicting opinions as to whether to do those shifts and whether to keep it the way it is, Yeah,
we did have a discussion. You're right, the opinions varied. The advantages of lowering the pay line is you give, and 8 was the percentage we're planning on lowering to discussing, gives you more money to do discretionary spending, if you will, a raise to pay things. The alternative is if you keep it at 10%, more people make the pay line, and so you're kind of feeling that you'll get the more meritorious grants by raising the pay line. there were differing opinions, but based on what we heard, the consensus seems to be to keep to be at the pay line. Gwen shaking her head. I don't know if you want to weigh in on this or not, but
I just would agree that we did take into account all the comments and had a conversation with Linda before she retired, and we determined that we would keep the pay line, because we advertise that, and the community, needs a sort of a beacon to go by, not knowing what our budget was going to look like, not knowing if we'd get a raise in our extramural budget. So we're at 10% for this year, and each year we'll consider, these kinds of issues, because it's a dynamic system, and we're always trying to maximize the amount of awards that we can make.
we actually started our process doing both before we had the discussion here, looking at an 8% pay line and a 10% pay line. Our program officers were often confused about where we're going with it, but in the end, we settled on the 10% based on the discussion at council last round, yeah.
So then, Pat, when to follow up, at least for the next few cycles, it will remain at 10%.
For this whole year,
Yeah.
2020, fiscal year 2020 is 10%. And the processes that we've used in the past is how we will operate.
Yeah, and we'll reconsider every year like we have every year.
Given that we have a little cushion coming in with the budget increase, that helps to support the notion that we'll keep it at 10% or if not above. So
Yeah.
we heard you, and we're keeping it at 10%.
But a good question, thanks. Any other questions from council members before I move on to the Superfund budget? All right. So everything I've talked about so far is what we call a direct budget to DRT. We get money, of course, through our Superfund line here, and we support two programs, the Worker Training Program and the Superfund Research Program. As you can see from this circle, the vast majority of our worker training money goes to our U45 Center training grants. Yeah, and a small portion goes to small business. These are small business grants for what we call our e-learning program. This is we pay for grantees to develop online training for hazardous cleanup and so on. This does not include a $10 million pass-through money that we get from from the Department of Education for nuclear waste cleanup. The other program for Superfund is the Superfund Research Program, which you've heard a lot about this last couple of days. Again, the vast majority of it goes to a P42 program, but we also have a small business program, and this year, Superfund kicked in $1.5 million to the CHEER program to have availability to the CHEER resources for Superfund programs. The rest you see, the R25 and the R3, are things I just talked about a few minutes ago. Superfund also funds conferences, and I think this one, R21, is a time-sensitive grant that they paid, related to one of the hurricanes, if I'm not mistaken. So we also co-fund other ICs grants. We co-funded the Healthy BCD Health program. There's a lot of HEAL programs, if you noticed, NIH programs for different things. This is for children's developmental study through NIDA. We contributed to that. As I mentioned, we're part of this telomere program now that Michelle Heacock is involved with. We co-funded a coordinating center that NIA is administering, but we're co-funding. We had a couple of, not together, small business things that we co-funded, as well as a training program through Fogarty, and some other things. I'll not go into the details, but conference grants at other institutes. So we funded around $1.5 million to other, co-funded with other institutions. So that's it for 2019. So what are we looking forward to 2020? Yeah, as we just discussed, we're keeping the pay line at 10% for unsolicited RPGs, but we will be looking at choosing grants above the line in accordance with our strategic plan priority areas, as well as the processes we've had in place for some time. We are looking intently at early stage investigators up to the 25th percentile, as well as what we refer to as at-risk investigators. These are people who have received R01 funding but have somehow lost it, and we're trying to keep them in the family here to give them extra consideration so we don't lose them from the field entirely. We will do standard across-the-board cuts for some grants. This is just to optimize the number of grants. And as we discussed last round, we're Our target is to fund 25% set-asides or FOAs, a 60% in the pay line, and 50% raise to pay. That is always our target numbers. Some of the initiatives that we will be funding this year, and this is broken into two pieces. This first one is our, what you might call our recurring initiatives. So our P30s will be paying at least $6 million, it's still in discussion. Around $4 million for our river program. The organic typic culture models is a small business program that we did before, and we're reissuing that, funding about $4 million on that. Again, our ones awardees, ones award program we're paying again in Victor as well. The cohort maintenance is on the books to be paid. How that will look will depend a little bit on how we look at the discussion from yesterday. We have an undergraduate research program called UP. This Mike Humble runs. We invest about $9 million. This is for undergraduate research experiences. And then, of course, our time sensitive will continue that. Some one-time things that you should be aware of. Some of these are already in and being looked at. Pregnancy is a vulnerable time period for women's health. This is a little different. We're looking at pregnancy as a susceptible time period, but we're looking at the health of the mother, not looking at birth defects or birth outcomes. We're having a small business RFA on genetic diversity and tox testing, as well as one on environmental health literacy. And we have 2 RFAs for our framed program, functional RNA modifications, environmental and disease. This is the area known as epitranscriptomics. I've been practicing that one. It's a program that Fred's running, and this will be awarded this year as well. And we will also planning on co-funding some RFAs with other ICs. We recently did it was for September Council, this U.S.-China biomedical program. We'll be funding 3 of those to the tune of $1 million. Small business on the reproducibility of human iPS cells. OD, grant on the intersection of sex and gender influences on health and disease. And then, again, we'll continue to fund in the telomere grant program that we'll discuss later. And then our BIRCH program, which is building interdisciplinary research careers in women's health, to the tune of about $100,000 for a total of around $2 3/4 million investment there. Okay. Shifting gears a little bit, we also like to let you know things we've been doing since we last met. And so this is something else that didn't get onto the September Council agenda because of other priorities for the discussion. So I'm actually going to go back even further back to June Council. I'm only going to hit a few of these, but between June and September Council, we were very busy, participated in a number of meetings related to the work we do. I'm only going to focus on one, and that's going to be the worker training opioid pilot study, which is where I can find that. Uh-oh. I don't want to tell you wrong. If you were at September Council, there you go. If you were at September Council, you heard a great presentation by Steve Romero from the Auto Workers Union talking about opioid abuse in the workplace as a workplace issue. So, in response to this need, the worker training program developed an piloted opioid training programs, that could be used in the workplace to try to address this issue. Over the summer, they did some trainings to see how well the program worked. These trainings were at Hanford, Washington, Lowell, Massachusetts, New York, and Huntington, West Virginia. The goal of the pilots was to determine the effectiveness of the training tool as well as the training process in raising awareness and increasing knowledge surrounding topics focused on the prevention and response to opioid abuse in the workplace. You can learn more about this program in this report, which I don't have a website, but if you let me know, I will have Chip send that to you. They are also in 2020 planning on conducting 6-month evaluation surveys and interviews to gather information on on outcome stories, testimonials from the pilot training programs that we had there. So since last round, September, we've done a number of things. In fact, that so many we need to break this into 2 slides. This shows what some of the things that we're involved in September and October. The one I want to highlight here is the H3 Africa program. You've heard a little bit about this in the past. The purpose of the program is to create and support a pan-continental network of laboratories to study the complex interplay between environmental and genetic factors, which determines disease susceptibility and drug responses in African populations. We have been involved in this, and our 2 representatives are Kim McAllister and Bonnie Jobert that are working on this project. Bonnie attended this meeting, the 14th H3 Africa Consortium meeting in Accra, Ghana. The meeting involved project updates and presentations from the H3 Africa investigators, and including training and working group meetings. Bonnie was the rapporteur and facilitator of the H3 Africa Environmental Health Working Group, as well as the biorepository meeting. We'll be continuing our participation in this program going forward. So since looking in October and December, again, we were very busy. We went to participated in a number of meetings. Again, I won't go into all of them, but we cannot not talk about the breast cancer meeting. This was the annual meeting of the Breast Cancer and the Environment Research Program, or BSERP, was held in November in Atlanta. And sadly, it was the final annual meeting for the 17-year, very productive, very visible program. A.B. and Gwen and Les Reinleb attended. I need one more slide. Sorry. The highlights included this video on breast cancer survivors lending their voices. I highly recommend that you go to that website. Yeah, this will be in your slide set in your ECB. These are very powerful stories. I looked at them earlier, and I highly recommend that you look at them. Another highlight, of course, is Gwen presented the keynote address, having been involved with the program for so many years. And these meetings are kind of renowned for their poster sessions, not only from universities. I lost my slide, guys. There we go. But also the advocates and the communities presented posters as well, and this is always a hit of these meetings. And now I can't move forward. Okay. I just want to give you a few meetings that we will be involved with going forward in the near future that you might be interested in. One is happening right over there. The PEPH meeting is happening. It's actually, they're started already. The main meeting will start at 1 o'clock this afternoon. I think somebody mentioned the Tribal Advisory Committee, Rick, I think yesterday, and a variety of other things that I hope you'll find interesting and will attend. Can you all move me forward? John, Nathan, somebody? Okay. Just one more. Quick announcements. Charles Schmidt mentioned this yesterday, the Data Scholars Program. This is a program where we've been approved to have a national service person here come in, hopefully from industry or computer science, to help us move our programs forward. There'll be an application process that we'll keep you informed about. Next slide. There really is more. I'm almost done. I'll start talking. David wanted to let you know that the HERE program is ready to go online. There would have been a website up here where I could have told you to go. There are some requirements. You need to have an existing human study, epi or clinical, and there are some other requirements that I will let you go online and look at or talk to David, but we're in business now. The final thing I wanted to mention, and I don't need a slide for this probably, is that there's an RFI out now on it's inviting comments and suggestions for a proposed research initiative to decrease maternal mortality. This is an NIH thing out of the Office of the Director. It's a two-pronged research effort to reduce mortality, a multi-site, community-based participatory research effort to evaluate implementation effectiveness, and research opportunities to address risk factors and identify biomarkers of poor outcomes for women during pregnancy. As I mentioned, there you go. As I mentioned, we've always had an interest in pregnancy as a vulnerable time period. This kind of falls into that. So if you're interested, please weigh in. The due date is February 21st. All right, I think that's all I got. Any questions around the room? Anything? I gave you a lot of information there. I think we're still on schedule for the meeting. If not, I'm around the rest of the day. If you have questions, as are our DIRT staff, please feel free to ask questions. I don't have an agenda. I think our next one is Liam. Is that right?
Actually, we paused for a second because we have a retiring member of council, Maureen.
Yes.
So this gives me an opportunity to present you with a certificate of our appreciation for the time that you've served on council. So is Steve, the photographer, here? So we're going to wait for Steve to get here. If he's here, we're going to do it now. Okay. So hold on 1 second. Make sure that. Well, let's see. Let's just see if he's here. Great. Come on in. Lens cover off, and we're ready to go. Okay. So it's much appreciation. So thank you for your service on council. I'll smile again. Let's try that again.
Much better, but let me do one. I like to have two, just to make sure we got a good.
Thank you, guys.
Thank you for the honor.
So next on our agenda, can you hear me? Okay, is Liam O'Fallon, who's going to give us an update on the PEPH program. And then he's going to rush next door to the meeting that he set up on PEPH. So whenever your slides are ready.
Let's see.
Break this morning?
Yeah, Maureen, did you have a question? Comment?
Before Liam starts, I don't know whether you did this yesterday, and I apologize not being able to be here, but my turn on council and my contributions to council and my getting here on council would not have been possible without the support from Liz McNair. So I'm asking you to recognize Liz.
Where's Liz? There she is. Good.
Recognizing this.
Liz is terrific.
All right. So let's see if the AV works out here. Pat, usually they have folks like me go first to work the kinks out, and then have the directors go. So good morning, everybody. My name is Liam O'Fallon, and I am the coordinator for our Partnerships for Environmental Public Health. It's a pleasure to be standing here in front of you to update you on this initiative, this network that we have. It was in 2015 that we last brought this concept to, that I spoke to council about the Partnerships for Environmental Public Health, and before that it was in 2008 when Gwen Coleman had presented the actual concept for this PEPH network. So this has been an effort that's been in the making and operation for 12 years now. I want to thank Rick yesterday also for talking about how NAEHS has been committed to moving data to knowledge to action. And PEPH is what hopefully you'll get at the end of this is one of the mechanisms by which the Institute is committed to taking that data and really moving it to an action, to some type of public health action. And our grantees within this network really are at the forefront of doing this work. So my goals for today are to explain to those of you who are not familiar with PEPH what it is, to provide some examples of the successes that we've had over the last 12 years, outline some next steps for the future of PEPH, and then seek your input and guidance as we look to the future. As many of you may know, NAEHS since 1994, before I got on board, was really committed to engaging communities. Translating the science, we were at the forefront of environmental justice, community-based participatory research. And that commitment continues to extend, as you can see in this graph that I have before you. In about 2007, we looked across the board. We had an opportunity at that point in time to really take a good, close look at the types of work that we were doing. We saw that we had about 10, 11 types of programs that were doing a lot of the same types of things. They were using some of the similar types of methodologies. They were engaging with communities. They were addressing the questions of how is it that we are translating the science for environmental public health. And yet what we were also seeing is that there wasn't really a way for those grantees to be talking to one another. They were working effectively in their own programmatic silos. And that's fine, right? Silos serve their purposes. Grant programs serve their purposes. The grantees are interacting within those programs, sharing their advances. But we were seeing things like, these are just some of the examples, the Superfund research program. We had our environmental health sciences core centers, the worker training program. We developed the research to action program, and they're all siloed. They're sharing their own experiences, their approaches, the knowledge gained within that. And then, you look at the tops of the silos, and they are connected, right? They've got those little blue bridges across the top. But that's just kind of a small way in which they're interacting. And we saw this as an opportunity to think a little bit more creatively, to create a space at the base of these silos, an inviting environment for those grantees to come out of their silos, to interact, to exchange these ideas, to then, learn from one another, and then maybe go back up into their programmatic silos and continue that innovation, sharing what they had learned as they interacted with the other groups from those programs. So really, the PEPH vision at that time was to create a network. So our vision of PEPH is this network, to break down the silos, to help those grantees come together and promote that interaction and integration of ideas and practices around shared interests, such as research approaches, communication methods, evaluation approaches and methods, as well as to focus in on some common themes, whether it's health outcomes, specific vulnerable populations, exposures, whether they're known exposures or the new and emerging exposures that we're starting to hear about. And then to have conversations around the different types of partnerships, whether it's partnerships with community groups, whether it's partnerships with healthcare professionals, decision makers, state and health department officials. What are those ways in which we're engaging and developing partnerships? So to achieve and to realize that vision, we developed a framework around a definition of environmental public health. And you can see that the definition of environmental public health really gets to this issue of action and communication for some type of, to address the health concerns of the local community and residents. And the framework itself, as you can see here, is we have, let's go ahead and use a pointer. We've got research, a blurry communication. Sometimes that's how it feels like communication is. It can be a little bit blurry, right? Capacity building and evaluation all around the outside. As we defined evaluation around the outside, this was one of the key things that, as we engaged with our stakeholders in the development of this particular network, was absolutely essential, because evaluation needs to be encompassing everything that we're doing. And at the heart of it is the coordination of our environmental public health efforts. Now, the blurred lines that you do see between research, communication, capacity here, no, that's not the projector. That was intentional, because it's really at these intersections that we see an important opportunity. they shouldn't necessarily be research separate from communication. There are opportunities for really bringing those two disciplines together. So something to be thinking about as we considered the network. So what were the goals back in 2008 and that have really guided us through the last 12 years? Is to look at coordinating the programs and projects that involve community and science collaborations, as well as extending that beyond to the broader stakeholders, to develop and evaluate strategies and communicate the environmental public health messages to those communities, and then create and distribute materials to increase awareness about environmental health and environmental risk. So now, really what I want us to think about is, how have we done in terms of meeting those goals? Have we been successful in coordinating? Have we been successful in developing and evaluating strategies for communication and creating and distributing materials? So one of the things that came out, one of the approaches for trying to coordinate and communicate was to establish a website that would have the information about our grantees, that would have information about grant programs and opportunities that would be relevant to this particular area. And so we established a web page. We established a resource center that is a central repository of materials that have been created by our grantees. We've developed a newsletter. We have webinars, podcasts, highlights of our grantees. Social media was just really coming on board about 12 years ago, and I think we called it something along the lines of social network opportunities. We really didn't have an idea of what that was, but we've gotten on board. We've got a Twitter account. We've got a LinkedIn account. And I would say that one of the biggest strategies in terms of coordination and communication has been our annual meeting, our PEPH meeting. And as Pat said, that's taking place right next door here. And more on that in a little bit. So the Resource Center is one thing that I really want to touch on a lot, because this is, I think, a very powerful tool that we've established. And this has been done. We've been working with our contractors, MDB Incorporated. Thanks for their support in making this a reality. This online resource is available to our grantees. Its growth since 2015 has been 30% in terms of the number of materials. We now have 683 materials in the PEPH Resource Center. We've had a 61% growth of our users in the Resource Center. That's 895 people that you can find in there. Grantees that we consider, grantees and their partners that are a part of the PEPH network. We utilize the Resource Center as a way of highlighting materials and hopefully getting our grantees to connect with one another through shared interests and topic areas. So here's a screenshot of what it looks like. We try to feature the materials by calling them out. Sorry about the quality here of the image. But if you're searching for a particular materials on a certain topic, I just typed in PFAS the other day in preparation of this, and you can see that 10 materials pop up, and they're great materials. They look something like, you've got a nice fact sheet that's coming out of the University of Michigan. You've got a coloring book that's coming out of the University of Rhode Island. And then you've got a much more scientific type of fact sheet for a different kind of audience that's coming out of Boston University. So grantees are putting materials into this resource center, hopefully to stimulate ideas for others who might be looking to see about how best to communicate on a particular topic, and then maybe rather than creating something de novo, they can build off of what's been done and get these ideas. If you want to connect around a particular audience, you can look and see who's interested in healthcare and public health professionals. And you get a listing of folks. Here we've got 26 people within the PEPH Resource Center who have identified themselves as interested in engaging with this particular audience. You've got a listing of materials over here. So this resource center really is powerful. It's evolved over time. Over the last 12 years, it went from a pretty basic web page to something that's pretty dynamic. Grantees can go in, and if they like a particular material, it's kind of like going to, some of the social media pages and hitting a like feature and giving some type of an indication or placing comments in there. Through coordination and communication, the other aspect are webinars. We've been doing these, we try to do them on a monthly basis, every other month, something along those lines, but we've hosted many webinars since 2010, with an average of right around 150 participants in each one of those, with our highest attendance on a environmental justice, research to action kind of webinar focusing on the use of air monitors and community air mapping, with 427 attendees. But here's just kind of a general screenshot of what the average webinar page looks like, and at the bottom we tend to have resources. Our grantee highlights is a mechanism for trying to showcase the type of work that our grantees are doing, and it's not just the researchers. We're looking at the community partners as well as the students that are coming up. So here's one on Laurel Shader. She's doing some innovative work with communities on PFAS. And here we have one on Cheyenne Grabiak. He was a student at University of Arizona who didn't really know about environmental health sciences until he got engaged with the Community Engagement Corps that is a part of our Environmental Health Sciences Core Center. Learned about it, became more interested in terms of environmental health, and now he's a project manager that's doing work with the Environmental Health Sciences Core Center there at the University of Arizona, and is actually here at the meeting talking about engaging youth as it relates to environmental public health. So it's a way of being able to showcase some success stories. Through our social media, Twitter feeds, we push out materials about our podcasts, webinars, and other grantee highlights. The newsletter, I would say, is perhaps one of the most successful tools that we've had in terms of getting the word out about our grantees in environmental public health. 2010, when we started it, as you can see here, 434 subscribers. And now we have over 5,000 subscribers to the newsletter, with an open rate of greater than 50%. At face value, 50% doesn't sound like a whole lot. That's just a flip of a coin. So what is the industry standard for a PEP, or for a newsletter, online newsletter? 23%. I mean, we're doing twice that. I mean, this is pretty impressive in terms of where people are seeing the value in the newsletter. And in terms of the value of highlighting something, we posted some material on this product that was developed at the University of Washington through a supplement to their Environmental Health Sciences Core Center, their Community Engagement Core, and they worked with some of their tribal partners to develop the return, which is this screenshot here that is talking in terms of the tribal perspective on environmental health. When we highlighted it in the newsletter, it got over 9,000 hits. We thought, nah, that's impossible. We checked it every way from Sunday and found out that it was 9,000 hits. And maybe Terry was sitting there clicking on the link, over a weekend trying to get the hits. But I mean, it demonstrates a certain value in being able to get the newsletter out. And in case you've missed the newsletter, we have recently updated it, so it's a completely online, more interactive format. You scroll to the bottom, you can go back 2 years, and these are the storylines of our primary story. All of these are clickable. You can go back and read a little bit about certain projects on these topic areas, from citizen science to environmental health literacy to safe gardening. So I invite you, if you haven't visited the newsletter, to go and check it out. Not now, afterwards. But so somebody had asked me in terms of, well, were any actions taken? It's great that you've got a 50% open rate, but does anybody do anything with it, right? Well, we had done some focus group. We had done a little survey, and this is just a quick snapshot. We'll need to do a little bit more, but we did get 77 respondents who said that, that responded to it, and you can see that of that, about 62% strongly agree that they have taken some type of action as a result of looking at the PEPH newsletter. And so what kinds of actions might we see there? Well, they joined webinars. They talked about applying to grant opportunities. They shared the newsletter with their colleagues, looked up related information, applied for a fellowship opportunity. So I think that these are the types of things that are valuable to see in terms of people taking action when they get a newsletter. The podcast series is yet another mechanism by which we're trying to raise the awareness about the grantees and the work that they're doing. And these are 6 to 8 minute snippets highlighting Topics of asthma, citizen science, vaping a couple of years ago, opioids, and then it should be dropping into the queue any day now, one on wildfire smoke. This is what the page looks like. It's nice and simple. You can just go ahead and click and listen to it on your browser. No need to download iTunes or anything along those lines. Gives you a quick description of what the podcast is about and who the interviewee is. At the bottom, we provide additional resources, and where appropriate, we provide links to relevant peer-reviewed journal articles and other sources of information. Is being picked up. So when we put these out here, we've got the Health Resources and Services Administration linking to this exact podcast, telling their network about it. When we drop the opioids and worker health podcast out there, we're seeing that the Kendall County Health Department is picking up the podcast and promoting it to their community as well. So it's seen as a valuable resource in certain circles. We're also seeing that it's popping up on lists of interesting podcasts for public health professionals. So this one, 45 awesome podcasts. We're number 4. Not bad, just behind World Global Health Podcast and World Health Organization, of course. You can't really compete with them. More recently, here we go, public health podcasts you must follow in 2020. Top 15, right? Any guesses? Number 10. So, we're in there in the contention. So these are the types of, it seems to have value at this level. Is it perfect? Perhaps not. Is there room for improvement? You bet. But at least we're seeing that it is being picked up broadly and recognized for its value. And I'd like to conclude sort of this section of the types of materials that we're doing is the evaluation metrics manual that we created in partnership with our extramural grantees at their request back in 2010. And this, the metrics manual was published in February of 2012, and this is still one of our most downloaded resources on the page. And not only is it being downloaded, we're seeing that we're seeing it pop up in reviews and applications. People are utilizing the resources about developing metrics around partnerships, leveraging past work, products and dissemination, education and training, et cetera. I mean, it's a valuable resource. It's 12 years old, 10 years old now. So, maybe there's some need. We'll be discussing it in the meeting. PEPH, as I said, it's a network, and it's about building the network. And we do this a lot through our PEPH meetings, as well as organizing sessions at our at annual professional meetings, such as the APHA, the Society for Applied Anthropology, and other locations. But the meetings in themselves have been really instructive. We tend to organize them around a particular topic, whether it's environmental justice, environmental health literacy. As Katrina called out yesterday, we talked about reporting back research results. And it's about bringing people together and having this interaction, that face-to-face discussion about those strategies and approaches. What are those opportunities moving forward? And what we're seeing is that people really value this. The great thing about PEPH are the annual meetings. It's where you can connect with others who are doing this work, sharing those examples. It's about getting the face time with others in this area. So the folks who are attending the meetings see it as really important. We're seeing that the network continues to grow as well. I started off with the slide here talking about all of these programs. These were RFA-based programs, center programs. But we're also now starting to see more of the investigator-initiated, unsolicited folks getting involved in the PEPH network. We've got SBIR, SDTR types of projects coming in as well. So just really quick to summarize who's in it. These are folks who are conducting and translating research into action. They're communicating environmental health messages broadly, and then building the capacity of project partners to strengthen environmental health literacy and build skills for being engaged in environmental health science. So how has this been growing? We've done a quick look at our PEPH portfolio. This is like the sort of the N of who we would define as being a part of the PEPH network. And I want to keep in mind that PEPH is a network. We don't have any money. We're not giving out grants. These are folks who are part of other grant programs. So there were, in this network, we see about 259 projects. What we wanted to do was categorize them by the 4 main areas that I talked about as the framework of PEPH: capacity building, communication, research, and evaluation. And what we're seeing here is that 169, there are 169 projects that identified as having some type of capacity building effort, 120 in communication, 110 in research, and 52 in evaluation. We did a quick look to see kind of how that broke down as it related to certain mechanisms. And this blue bar here, now, not surprisingly, these are like our center-like programs. This is the Superfund Research Program. This is the core centers, the children's centers, the health disparities centers, worker training, really constitute this big, broad bar. But we're also seeing, rightfully so, within the research, we're seeing a lot of RO1s popping up. So this is, again, just a quick snapshot of who's a part of it, where they're fitting in, and how they're addressing these issues. And it's important because, we want to start looking forward in terms of the work that we're doing. And I know I'm running out of time. So, we're good? All right. So we're contributing to the research discussions as well. We've helped to, through the Partnerships for Environmental Public Health Network, we've helped to inform the Research to Action program. We've contributed to informing the discussions around the community engagement aspects of the Environmental Health Disparities Centers, the communication research program that was a part of the Breast Cancer and Environment Research Program, as well as helping to inform the concept that I presented to Council last time on the Pediatric and Reproductive Environmental Health Fellowship. It's through these types of interactions that we get the ideas and start to think about what are those next opportunities. We've also helped to advance new areas. Perhaps you've heard the concept environmental health literacy. This is something that really started out as a conversation amongst the PEPH network members. Citizen science, we were in a nice position to bring that concept in and start knocking it around. And then tribal ecological knowledge is something that we've been able to really advance and consider within this network. So environmental health literacy, it started with a meeting, really, bringing folks together around the question, presenting a definition. It led to a commentary in the environmental health perspectives that led to a book that Sima Finn and myself co-edited, but with the contributions of many of the grantees who are part of the Partnerships for Environmental Public Health, many of whom are right next door. And that has led to many peer-reviewed journal articles that we're starting to see in this area, talking about environmental health literacy, coming from a diversity of institutions and individuals. Similar is citizen science. When the concept of citizen science really started hitting the federal radar a few years ago, people were looking to NAEHS, asking us how we saw citizen science and how was it that we were going to incorporate citizen science into the work that we did. And I kind of looked at them and said, but I think we are. But it did get us to think about a little bit more how it is that we're doing it in a way that understands the different motivations for being involved. Sima Finn and I worked with grantees, with our extramural community to think about and knock around this idea and create a framework that talks about different motivations from a PI's perspective, as well as perhaps motivations from a community participant's perspective. And I'm happy to talk with you more about this, this framework. But by having these conversations, we were also put in a position where we were able to highlight some of the work that was being done, something that other federal agencies didn't really have a position in doing. So we established a community engaged research citizen science page to highlight the work that our grantees were doing across the different programs. And then also we've seen more in terms of the work that our grantees are doing in this sphere to talk about citizen science as it relates to environmental public health and working collaboratively with community groups to address their issues. And then as as we've been looking at that, one of the things that we did do is we looked at the publications. We've been doing a lot of work in community engaged research. How does that relate to the publications? And 50% of the publications on community engaged research were written by authors funded by NAEHS, where they've either cited it or authors who have been supported by NAEHS at some point in time. So, I mean, we're there at the forefront. This statistic doesn't include the gray literature that many of our grantees are contributing to. We're also in a position where we're able to respond to emerging issues. So we heard yesterday from Rick talking about vaping and electronic nicotine delivery systems. Through the PEPH, we have a lot of people on the ground talking with communities, hearing what the questions are and the concerns are in terms of the information that they're seeking. And so we were able to respond. We developed a podcast where we talked with Alona Jaspers. And then also as part of PEPH, we've got a workshop that's taking place talking about vaping materials, resources, and communication. Another one on building educators' capacity to talk about it. We'll have some hands-on activities about e-cigarettes. There's actually a sensor. There's going to be a table out here. They're going to lay out some of the different types of delivery systems. And the folks at the Pediatric Environmental Health Specialty Unit working with the folks at Harvard have created a little chamber for testing out some of the sensors to look at what's in the vape. So, I mean, there's some really innovative efforts. Also, we've got, in terms of environmental health literacy, the Science Takeout Kits have just released a new one that's focused in on vaping, and they're going to have that as part of the PEPH meeting. So it is a network who's responding and creating novel materials and trying to help communicate what it is about vaping and raise awareness about it. So what's the future? What does the future hold? Well, as we've mentioned, the meeting's taking place right after council concludes, and the idea is we want to start looking to the future. It's been 12 years since this concept was brought to council. It's about time that we think about it. A lot has evolved, a lot has taken place, there are new technologies, there are new issues and questions out there. So that's what we want to look at for the next day and a half as part of the Partnerships for Environmental Public Health. We're having breakout sessions on these 4 areas of communication, research, capacity building, evaluation. What are the opportunities for the next 10 years? Where do we need to be thinking about going? How is the network poised and ready to address those issues? We want to get that feedback. I want to get it so that maybe September, maybe next February, at some point come back to council with a refreshed concept for PEPH 2030. And like I said, we're going to be looking at these areas in terms of community engaged research, exposure science, citizen science, how it is that we might build capacity to use the new translational research framework, and how is it that we're building and measuring environmental health literacy. So we've got a timeline out there. We're asking people to contribute to a timeline in terms of how PEPH has helped to inform some of the work that they're doing, as well as to start brainstorming and thinking about what the future holds. So if you're so moved and you want to grab a stick-it and put something out there right now, after council, before you hop on your buses and jump on your planes to head back home, I invite you to just go check out the timeline and put something down there to get us to think about where we need to be going for the next 10 years. Of course, it's not one person doing this. I've had the opportunity of working with an amazing team. I know that we're bringing on new faces as well, contributing to it. And of course, there's a whole group of contracting support that takes place to make this happen. MDB, Image Associates, NETI, and Attain have all been extremely influential in making PEPH a success and communicating broadly. And so with that, I want to thank you for your time, and I welcome any feedback, questions that you might have. And thanks for the extra time, Pat.
Thank you, Em. We do have some time for questions from council, and people who are on WebEx and you have questions, please chime in. So, anyone? Questions, hands to be raised. Terry?
Terry?
Thanks, Liam. A really wonderful presentation, and appreciate everything you guys are doing. I think this is one of the stellar programs that the Institute has and really valuable to those of us who have programs that engage in this area. So thanks.
Okay.
So what he said was, thank you, it's a stellar program. He wants to hear more.
Yeah, you're going to need a T-shirt
Thank you,
made of
Terry.
that, right? Yeah. Marla, did you want to go, please?
Thank you very much. I think this was wonderful, and I think this can be the model for many other initiatives in other federal agencies. NSF should be looking at this for a lot of issues. So I'm blown away. If you can please stay with me for a little while and talk more, one-on-one, that will be wonderful.
Thank you. Happy to talk more.
Thank you. Question? Oh, I'm sorry. Yeah.
Hey, Liam, I was just thinking as you were presenting, and I hadn't thought of this before, but what an incredible resource the Resource Center would be for people outside of the grantees, the fact sheets and things like that. And the fact that you understand have to sign in, and maybe it's through the participants of a way to do a broader dissemination to local and state public health and agencies that could really benefit when communities. I think we have some covered, but most of the folks are either focusing on a particular community, so to have a systematic way to make sure that that great resource is being disseminated beyond the grantees and people who have that access.
That's a good point, Edith, and it's been a challenge, right? And I think that can be one of these points of conversation to have in terms of, you have to have a login, you have to remember your password, all this. And so what might the appropriate strategy be for getting and amplifying the access to the Resource Center? Yeah.
So thank you, Liam. I spent a lot of time with this group, and I was still really amazed and impressed by the breadth of activities in this area and also their growth over time. And my question is about your sphere of capacity building, and particularly in professional development. So clearly PEPH has had a huge impact, and in fact you could say it's created a field, and importantly also has grown understanding throughout the EH enterprise of how important this kind of work is, and making sure that environmental health, natural science research gets used to address public health problems, because this is really where the rubber meets the road. Directly for translation and everything we need to talk about, directly working with end users, whether they're communities, healthcare providers, public health professionals, policymakers, and core to doing that work well is rigorous social science, anthropology, sociology, economics, policy sciences, communication, education, law. I'd be in trouble if I left out the humanities, arts, literature, and particularly ethics. And one of the things that we usually hear about when people are presenting concepts to us here is pipeline development. So there's only one T32 that addresses social science and environmental health, and I don't know of any other programs that focus specifically on career development in this area. So I'm wondering what progress you've seen through PEPH in terms of development of social science and environmental health as an academic discipline, what remaining needs there are, and what plans you have going forward.
Well, certainly, yes, there's been one T32 that has been, kind of the model in terms of creating that opportunity for bringing in social science to the environmental public health sphere. And, I believe that Phil Brown has done a fantastic job in terms of really trying to get that message out broadly. I just have to say I'm glad that we've got, Lindsay on board now that Simma's retired to be able to work on and continue to nurture the engagement with the social science community and to be thinking about what those next steps are and being actively engaged with the different networks. So yes, I think as we're moving forward, that's something that we don't want to lose sight of in our next iteration of the plan.
I just got a note from Andy. I'm sorry, just a second. Hang on just, Andy, we have one question on the okay, yeah, that you're trying to ask a question, but your mic is muted, so I'm looking over. Can you unmute Andy Shee's mic? On the WebEx. Well, I tell you what, while you got it? Andy, can you hear us now? I tell you what, while we work out this technical issue, Maureen, why don't you ask your question? We'll come back to you, Andy.
First, Liam, you know what a supporter I am of this network and what you're doing, and I've been following this all along. I think you bring up an important point in terms of looking to the future. One suggestion I have, and I hope we have some more time this afternoon to discuss it as part of the research, is focus on and building on the trust, leverage the trust that this network has, and focus on the things that we can do with communities and communities can help us do in terms of addressing those factors that influence susceptibility. So issues like how do we address the non-chemical stressors? How do we address whether it's the psychosocial issues or just the notion of what it takes to live well, the role of nutrition. When we look at maternal mortality and the role of prenatal care and the link between nutrition and exposures and impact. And so I think it's a shifting perhaps to the left to take more of an exposomic approach, more of a lifespan approach, but being able to bring those messages from trusted sources, whether you use podcasts or some other ways. And so that's one area. The second is that, and that's a discussion, of course, it's an internal discussion to be had, but to make make the PEPH network, I'm not saying mandatory, but in RFPs, make it more explicit that that's an expectation of grantees coming in, particularly when we have cohort, kind of designs and from the EPI design. So that we're putting it out there within the RFP and creating some kind of expectation rather than leaving it completely voluntary. I know it's embedded in some of the Superfund programs and the P30s, but so those are two suggestions.
No, that's a really good one in terms of just making sure that we're a little bit more explicit and in terms of having language in certain funding opportunity announcements. And we do try to reach out as after each council round, as there are new grants that come into our portfolio, to look at the science that's being proposed and reach out to folks that we see as having science within the area of PEPH and send them a welcome note saying, hey, we've looked at the work that you're doing. This is part of a network. We invite you to be a part of this community. So, but in terms of getting the language more broadly, and the exposomics is absolutely on par. And I believe that community groups want to hear more about exposomics as well.
Andy, I'm going to ask you one more time. Can you speak and see if we can hear you? If not, I can read your message out loud. Okay, so not hearing you. What Andy had sent was...
Check one. Hello?
Yeah, are you there? Hello?
Hello?
Yeah, Andy, is that you? I guess you can't hear us.
No, this is Shukmei.
Oh, Shukmei, okay. Hang on just one second. So this is what Andy texted me. I am similarly impressed by the scope and impact of your team's work. I agree that it should be a model for other institutions. Mental health and child health come immediately to mind. Maybe we could also advocate for an opportunity to present at the IACC, which is the Interagency Autism Coordinating Committee. Thank you, Andy. Sorry, you can in your own voice. So now I have a question off to my right. Bob?
Wonderful, impressive presentation. I was just wondering about, I think it follows along the lines of what Andy just said, sort of engagement with other institutes and centers. I think the cancer centers, they do community engagement. The CTSAs from NCATS do community engagement. I wonder if there would be some value in maybe having joint meetings. Does it kind of foster collaboration across these different centers, across the different institutes, and maybe bring a little more environmental focused into what they're doing?
I think that sounds like a great idea in terms of how we might be able to amplify the network and build it. I think that's one of the goals of looking forward is, yes, we've got a network, but who are those next partners? How can we strengthen it and amplify it? So thanks for that. Yeah.
I think that's a great idea. Wouldn't it be wonderful to have kind of a central NIH community engagement with an integrated message? Francis, are you listening?
Well, this is Shukmei. This is Shukmei. I want to have a follow-up on that. Basically, I think a centralized networks or coordinated network system with all the other ICs would be a wonderful idea. TSA as well as NCI, they all need this kind of community outreach and engagement to support their research. The second thing I was thinking about is that it's very hard and difficult to actually find mechanisms to publish the work. So I know how hard it is to really publish this kind of work. So is there any way that maybe perhaps EHP or other journals will designate a different format than a very intense, full-fledged paper that needs to be, because if the community groups are leading the efforts, resources have to be provided for them, like statistics and other things. So I think that may be something one can consider.
I think I saw Lynn's hand first and then Katrina.
I have a couple of comments. First, in terms of publishing, one thing I think maybe you could consider is that you have a newsletter and you're also doing these podcasts, and maybe to sometimes have guests who can write things, such as, Shokmei could write something or give a podcast, and that could be a way for the broader community to also participate in your network. I can imagine doing that. It wouldn't be the same as having something in an academic journal, but I think if the point is to communicate to the actual public, they don't read those journals, so this would probably be a much more effective way of doing that. So I would just kind of put that on your radar screen. The other thing is I would not actually advise Francis to lump all these things together as if there's one community that all of NIH relates to. However, I do think that embedded in that idea, there's some really great approaches that probably you already are to some extent taking. I was thinking about the breast cancer meeting you had and the extensive work that NCI does, with the breast cancer community, which is an enormous community. And among that community, there's a subset who's very passionate about environmental health, and they're probably the people that are more likely to be coming to you. But it would be great if you had a broader outreach to all of the cancer community, because many of the organizations who advocate on behalf of breast cancer and breast cancer survivors, just as one example, you could take prostate or any other cancer the same way, would probably like to receive the information that you're putting out there and might enjoy coming together with the other organizations when you're bringing people together. And that's true for the autism community. There are all these communities of people, who care about NIH because of diseases they have or their family members have that the other institutes are tapping into all the time. And so I do think that could be, and then there's some kind of broad, I think you hit the broad environmental health advocacy community pretty well. But I think that some of them, there are other parts of NIH that there are things going on that they're probably not aware of that they'd be interested in. So there could be some reciprocity here where you by working together, you would actually be helping the other institutes too.
I guess my only point would be that we have these silos in the forms of 27 institutes or centers. It would be nice to start building some type of a platform to minimize the siloing that's occurring. And if we can be engaging with them, the message from many of the other ICs is about curing, the different diseases. Our message is getting out with them in partnership with them and letting them know that there may be environmental exposures that you should be aware of that could be preventing the disease from happening in the first place. And environmental exposures that, or just promoting the idea of health versus sickness. It would be good to get people in the room together and just talk this over. And in fact, one tangible thing we could do is, and perhaps invite, according to Lynn's suggestion, invite key people at the NCI or NICHD to actually write a piece for your newsletter.
So can we take two more questions? I'm sorry.
Back to that, off and on, the director's office in NIH has people who are charged with kind of coordinating public health, and they do various things over the years. I sometimes know them, sometimes I don't. Sometimes they're working with public health communities, sometimes they're not. But they've, as far as I know, they've never seen themselves as having the kind of function that we're talking about, and that could be a really nice functionality to have there, you know, a place that this effort could connect with, and also a more external facing role than they've had. A lot of their role has been kind of internal, trying to make people put more prevention into their research agendas for the institutes, which of course I'm all in favor of as a public health school dean, but there hasn't been the kind of outreach that you're talking about, I don't think, coming, you know, from that office.
So I think can we do three last questions? We'll go Katrina, Gary, and then Seema, and then wrap it up.
Okay, thanks. I'm going to try to quickly drill down a little bit on the things that Lynn and Rick both just said, and not to overuse the metaphor of silos and bridging silos, since that's what I called my book. But that I think what is important to focus on is why. You know, so there are merits to silos, and there are problems that those cause, and if we need to be really clear on what problem we're solving. So in this idea of bridging between different institutes, I encourage you to really stay clear on what's unique about our field and what's different. So in this area, as Lynn points out, publication in academic journals is not the gold standard. It's getting research used and whatever vehicles for communication that are most effective. And that's why this multitude of different venues that Liam's presented is so important. The second thing is really remembering what's so special about our field. As you say, not being disease and cure focused as other institutes are, but the upstream focus, the focus on the environment, which is outside of environmental health, and bumping up against policy, quite frankly, which I think makes this particularly tricky and unique. And therefore the kinds of audiences that we appeal to. So finally, when we're promoting the relevant, but I do think that this kind of engagement can be really helpful to other institutes, because the communities, especially the disease-focused communities, get and care very much about environmental contributors, and I think they can help NAEHS form bridges to other institutes.
Thank you. And Gary?
Liam, thank you. That was a great presentation. I just wanted to follow up on what Lynn said regarding the NCI and the opportunity to participate there. And I think it extends beyond breast cancer, and I want to mention a couple of programs. The Cancer Oncology Research Program, which focuses on communities, and also our Cancer Centers Program. There's an effort to focus more on the populations within specific catchment areas and the issues that are most important to those catchment areas. And so even within NCI, we tend to work in silos, but those are two programs that I think could benefit from that, and we'd love to have you come talk to us more about that.
Well,
thanks.
And can I just build off of that too? I know that also within the cancer programs, you have a very strong focus on the communication research, communication science aspect as well, which I think would be a nice opportunity to try to build off of and engage with some more.
Thank you, Liam, for your leadership and your energy and enthusiasm. I really appreciate it. I would hope that you would connect with county health departments, because they could help disseminate some of this information. And some of the community groups I work with, they would love to engage with the academic literature, but they don't have access because they don't subscribe to JSTOR and all of the databases that you need in order to get access to those journals. So I'm pushing a lot for open access. Linda gave a talk a couple of years ago at the University of Texas at El Paso. A lot of community members went, and when she did her presentation, they were saying, how can we get those articles that she's talking about? Well, the problem is access, right? So that's something that I'm very happy that you're doing this, and I would hope that we synthesize this academic literature and make it accessible to people who need it in order to help them with their communities. Air quality is one of the areas where people need information in rural communities. And so some of the libraries that serve these populations have limited hours and they don't have access to that. So if we can all push for open access journals, I would be very happy.
Thank you. Great presentation, Liam, and great discussion from the group. Thank you very much.
Thank you all very much for your time.
Our last program, and I can't find my schedule, is on the small business program concepts. Ravi Chandra will be presenting. He is one of our two SBIR and STTR program officers, and he'll be giving you an update. And we will have a concept at the end of this, so hang around. We do need a vote.
Morning. Good morning, everyone. I'm Lingam Naidu Ravichandran. I work closely with Dan Shaughnessy in managing the NAEHS SBI program. It's a team effort. It's just not us, but it's a scientific review branch, Leroy and Alfonso, who helps us in reviewing some of our specific funding announcements. Also, the immense help we get from the grants management in making these awards in a timely manner. So what I'm going to do is to briefly give a background about this SBI program and then provide an update on the two recent funding announcements that we had for which we funded applications, and then present you with 4 different concepts that we would like to use it for making RFAs for the small business program, and then open it for discussion, and then looking for feedback from you as well. So as you all know, small business program, it was authorized mainly to involve the small businesses with the use of federal R&D money to develop technologies and tools that is broadly useful. And so the goal, this was originally authorized in 1982, and then Congress revisits it every few years and then makes some changes. And the most recent authorization happened in 2018, and it's good for until 2022. So the two flavors of this is one is small business innovation research, where it's a requirement is the small businesses get involved, develop technologies using the federal R&D needs, meet those needs, as well as develop technologies that are commercially available. And then STTR is where there's a requirement where small business work with the U.S. academic institutions developing these technologies. And these programs, those agencies that are meet those requirements need to set aside at minimum of 3.2% for the small business program and then 0.45% for the small STTR program. So the overall goal of this program is to stimulate technology innovation and use the small businesses meeting the federal R&D needs, and then also foster and encourage participation of minorities, disadvantaged persons, as well as women in technology innovation. And the goal is to increase private sector commercialization that leads to technologies that are useful. For the STTR program, there's 2 other additional requirements in a way that it also encourages cooperative research interaction between an academic institution and the small businesses. And then the goal is to transfer some technologies that are developed in the small academic institutions, get transferred to the small business so they can make those into actual products that's useful. So this slide kind of gives an overview of those 2 programs, so side by side. So both programs require the company need to be within the U.S. So only U.S.-based companies that has a owner is either a permanent resident or a U.S. citizen, only they are eligible to apply for small business grants. And we often get this question whether academic institutions, can they apply for small business grants? The question is yes and no. No in the sense that they cannot directly apply, but they are allowed to participate in both these programs, either working with the small businesses. For the SBIR, they can collaborate with them and get a sub-award, whereas for STTR, it's a requirement that program by default, they need to work with the small business need to work with a nonprofit organization. So, and then other requirement is that company that applies for these grants, that has to be under 500 employees, and then at least for the phase 1, 2/3 of the work need to be done in the company, whereas for the phase 2 for the SBIR, at least half the work need to be done. So that's where the collaboration with the U.S. academic institutions can come in and they can apply through the small business. For the STTR, based on the requirement, at least 40% of the work need to be done by the for-profit company, and then 30% can be by the academic institution, and the other 30% can be distributed whatever the applicants needs. And then with SBIR, at least right now, 11 federal agencies with more than $100 million of the external funding participate in this, and with a minimum 3.2% set aside for NAEHS, that translates to about $16.3 million. And then within NAEHS, we also have the Superfund Research Program that is a separate set aside that currently that's about $1.7 million. And then Workers Training Program is about $750,000. So always the award has to be made to the small businesses. And so for the STTR, the current set aside is about $2.6 million. So this slide kind of gives an overview of different mechanisms that exist within the SBI program. The phase one is a traditional mechanism, and where somebody want to do a feasibility studies, they can apply for these grants. Then they can do this for 6 months, and they can ask up to $225,000. And then after that, once they have developed that, they can apply for phase two program, where this is a 2-year program. They can ask for up to $1.5 million, and then they can further develop the technology and refine it and make a product out of that. And then the fast track program is kind of combines these two, so they submit as one application. Both applications get reviewed at the same time, and the advantage with that is once they're done with the phase one part, their progress milestones against the milestones assessed by the program staff, and then if they meet their goals, and then they can immediately the phase two part can start, so there's no break in the award period. And then direct phase two is the most recent one that Congress authorized, and where those who have already done a phase one equivalent work, not with the non-SBI money, they can apply for a direct phase two, so that way they can straight away go to the full development of the technology. So with that, the idea is by the end of phase two, they have a technology that's good to commercialize, but it often happens that they may not have that. So the Congress authorized additional ways to use some money to develop those things. One is a phase two program where if they need to do more scientific research further to develop the technology, they can apply phase 2B. And usually NAEHS, we only do through more of targeted funding announcement. And then the other one is the commercialization readiness program. So this is something where if somebody need to use the SBR money to do some commercialization related activities like marketing research or manufacturing assistance or doing IP research and landscape, doing those kind of things, they can apply through this. This is a competitive application where they apply and get up to $300,000 over a period of two years, and they can use that, and then that way they will be able to develop the technology and move forward. So overall, the goal is to translate these technologies into products that are commercially available and for broader use. And then it's not the goal is to, NIH is the end user, it's just NIH is just facilitating this development of these technologies. And so we receive most of applications through what we call as omnibus mechanism. So we use two mechanisms. One is omnibus, another one is an RFA-based one. So we receive the omnibus applications 3 times a year. We kind of have a detailed high-level topics that we publish almost every year in the description along with all the ICs within NIH. So this is about a 270-page document that's available. That's a link there. So we'll be, after next receipt date of April 6th, we'll be updating these topics as well. And then I would encourage you to look at the topics and see if there's something that we are missing that we'd like to add to those. We can add those topics to that as well. So the other mechanism we do use is the targeted funding announcements. So I'll go through those in the later part of my presentation. So for the omnibus topics, we have 6 different areas overall in our omnibus topics. So this kind of lists those. And so for the top one is the exposure assessment. We are looking for sensors or tools that can assess the exposures, and then also can incorporate some information or computational technologies in doing those. And then for toxicity screening modeling, this is more for reduce, refine, reuse, replace animal use. These could be developing technologies like improved methodologies for screening chemical toxicity, or developing organotypic culture models, or developing predictive toxicology assays, or other tools like developing novel tools to extract information from, for example, we had archive tissues where they can extract that information. And then the biomonitoring and biomarker is developing ways to assess the exposures at the personal level, or some of the responses that one have in a exposure. And then nano-environmental health exposure is something that kind of combines all the three, but it's more focused just for nanomaterials. And then intervention technologies is kind of an extension or complementary to the Superfund program, but this we are looking for more like a intervention at the personal level, or at the consumer level, or at the household level. So basically removing contaminants in the drinking water inside the house, or developing new better technologies for filtering some of the VOCs inside the house. And then that could be also alerting people about some of the exposures. The education outreach, as Liam highlighted, so we kind of work closely with him as well in terms of developing some of the tools related to improving EHS literacy, promoting understanding of EHS, and then developing citizen science-related activities. So this slide kind of gives a high-level information about how the funding in the last 2 years. As you can see, roughly about 2/3 to 3/4 of our funding towards toxicology assays or exposure assessments. We basically get a lot of applications in these two areas, and then this kind of reflects the number of applications we receive as well. So the other areas, sometimes they may not perform well. So we kind of use the RFA mechanism to push, fund more grants in those areas. So for the focus RFA, so as I mentioned, we utilize both omnibus and target RFA to do this. For the target RFA, we basically use for emerging areas. For example, there's a need, then we can focus using RFA to do those funding announcements. Our topics that are unique to ES are areas that the need that we identify, are areas where usually only receive few applications, or the applications that don't perform very well in the CSR review because of the broader nature of the panel that these applications go to. So we kind of do this, advantage with that is it's a focus panel members. So the applications get compared among those that are kind of related to each other. And then also it gives, we kind of do about 2 RFAs per year to promote these goals. So this slide kind of gives a high-level information about the different RFAs we had in the last 5 years or so. As you can see, that at least we did 2 RFAs in the last 5 years. And the top 4 are the ones, those are the ones we already funded the grants. They're either active or they're finishing the phase 1 and then they're kind of transitioning to the phase 2. And even though at the outset they look like most of them are related to toxicology-related screening, but they all have a unique requirement in a way that, for example, the top one is for extracting information from archive tissues. The next one is, this is for a phase 2B mechanism where the technology is already developed through a phase 2, they can do more validation and then test those, and either blinded chemicals or multi-lab studies. So that kind of experiment, they can do that. And then third one is to find the effect of chemical toxins on cell differentiation. And then the fourth one is to incorporate experimental animal cells from experimental animal cells for toxicity screening. This is more meant for promoting more of the use of the 3D culture models, microfluidic systems that are already being developed through NIH and NCATS program for the human. So this is to build more confidence for the human chips by providing animal-based system where there's a lot of data exists in the animals, so that way that can help building more confidence in those things. And the next 2 that's highlighted in green, I'll go through these in the next few slides. The last 2 are the ones that we just had announcements and we've received applications, and those will be reviewed in the next couple of months, and then hopefully we'll be able to share those in the next year. So one of the funding announcements we had was to analyze exposure, characterizing the exposures, responses to engineering nanomaterials. This is an SBR mechanism. We said phase 1 and fast track applications are acceptable. Again, this is to develop or adapt novel technologies to enable exposure to engineering nanomaterials. And this could be also developing assays for biological responses to engineering nanomaterials. It could be through any route of exposure like skin, GI tract, or lung. and they can also look for any of the biological effects. And also we said we'll accept application in terms of identifying, characterizing the engineering nanomaterials. So based on this RFA, after the review, so far we have funded 4 applications in this. This gives high-level information about those applications. The top 2 are more related to inhalation-related assessment, developing technologies for that. So first one is from the company Aerosol Dynamics. What they're doing is they're developing an air-liquid interface system to directly assess the exposure to engineering nanomaterials, where the nanomaterial gets in on the top, and then they gets condensed, and then the cells gets exposed at the bottom of the cells of the well. And so they're trying to develop this technology. And the next one is their company, CFD Research. What they're doing is kind of similar one, but they're using a microfluidic system. So where the cells, different types of cells are grown side by side, and then they're exposing this to engineering nanomaterials. And the one at the bottom is they're kind of doing a way where to test this on a GI model. So they have in vitro intestinal tissue model. They're developing that model, and then they will be able to do some biological effects of some of the engineering nanomaterials on those. And then NanoSafe is a company kind of doing it slightly differently, where what they're trying to do is they're trying to develop a service-based system where somebody consumer products or 3D printers, those kind of things, which has a possibility of having a nanomaterials. If they send their product to them, they will be able to assess in a clean room if these release nanomaterials while in the use or while they are in a condition where, so that way they can assess and then certify them they are nanomaterial free. So, and also they can identify what kind of nanomaterials that are released from this. So they're kind of developing a kind of a service-based system for engineering nanomaterials. And the other RFA we had was, as Liam mentioned, is 2 RFAs actually. One is for SBIR, another for the STTR, where we accepted phase 1 and fast track applications. This is to develop innovative approaches for improving environmental health literacy. So we said we will accept applications, anything related to development of tools or activities or materials related to environmental health literacy that can educate students, community members, or healthcare professionals. And that can also, they can develop interactive digital media or web-based systems. And then they also develops kits or other tools that can be used for educating population about the exposure risks. And then also any training materials that can be useful as well. So this slide kind of gives information about the 3 grants that we funded so far. There's one more in progress, in the process of being funded. The top one, a science takeout kit, which Liam kind of alluded to earlier. So this is something, this is an STTR application that we received, and then Katrina is one of the co-PIs in this grant. So this is basically what they're trying to develop is a lab in a bag kit. So to educate community members as well as schools about risks involved with the vaping. So pre-kids too. So yeah, so pre-kids, and then so this will educate them about the chemicals involved, flavoring, ultrafine particles, and then heavy metals. Hopefully they're going to, this is a phase 1 program, so they're going to refine the product, and then they're going to make it available for broader community as they go along. And then second one is a company called Speak Agents. So this company already has a footprint in terms of developing technologies to educate students. And so what they're trying to now is trying to use our RFA funding to develop technologies to this interactive digital media to educate elementary school kids in this case to develop, educate them about some of the risk involved in the air, water, food exposures, and they also focus on low-income families and also ESL population. So they're going to make it as a bilingual products, so that'll be probably useful. So they're probably going to, again, validate them in Baltimore to start with, and then later they're going to develop into broader community. And then third funding announcement for funding we did was to a company called Nizumbi. So they're kind of approaching it 2 different ways. One is they're developing a gamified software where students can go and try at different conditions to see how different exposures can affect their health, and then over a period of time what diseases they develop. And then also they're developing a kit that students can use in the lab to see epigenetic changes, how that affects. For example, there's a gene that is silenced, reported gene, and they're exposed to different agents patients, what happens is silencing goes away and the gene gets expressed. This is a reporter gene, they can look at it. So that way they know what kind of conditions can lead to this. So just basically to educate students about the risks involved, and then what they can make some behavioral changes based on that. So with that, I would like to bring in 4 new concepts for further for your consideration. So I will go through those all in the next few slides. So one of them is developmental neurotoxicity related tools or assays for environmental health research. As you all know, NAEHS one of the new strategic plans, we do have neuroscience as one of the focus areas. And then within NTP, with the new reorganization, they also started the developmental neurotoxicity health effect innovation, where to translate some basic research into actual health-related meaningful results. So, and then you probably all remember that in the last council, Mamta Bell gave a specific, whole presentation on this specific topic on neurotoxicity. So what we would like to use is use the SBR mechanism to promote the developing the tools or technologies that are required to further to advance this area. So basically, the NTP also have put together about 80 compounds that they have a library of compounds that's available for broader community use. So we will we recommend our SBR applicants to use these compounds when they apply for this RFA. So that way the results can be compared to know what the biological effects, and then that also build confidence in the assays and the endpoints what they're developing. So the goal is to identify the environmental chemicals that are toxic, neurotoxic, and then hopefully we'll be able to prevent them, and then hopefully they'll have a translation effect in terms of avoiding the neurodevelopmental disorders. So we like to approach this in 3 different ways. One is doing more high throughput, high content assays. It's more, hopefully there will be more complex assays where they use 3D culture models or microfluidic systems, or use more cells like glial cells and other blood-brain barriers mechanisms. And the idea is to develop these complex systems so they can test these compounds. Other one is to develop more in vitro, in vivo extrapolation, and where also the possible incorporate some cross-species extrapolation in this one. And then the third one is to do exposure assessment, translation research. So if they can develop some imaging technologies to track chemical partitioning between the tissues, or doing like in vivo imaging of reporters that can be tracked to see how the changes can affect, or it could be, for example, real-time imaging of synaptogenesis. So those technologies may be useful in terms of imaging technologies could be useful for doing those kind of things. And then for the clinically relevant markers, if there is already identified markers, they want to do some microphysiological experiments, they can apply through this particular mechanism, and then hopefully they're able to use that to develop and validate those things in terms of their biological function and the relevance to these disorders. The other concept we have is artificial intelligence and machine learning approaches for advancing EHS research. As we heard a whole lot yesterday about the data science, how that gives new opportunities and challenges. And so hopefully we'll be able to make use of this SPI mechanism to promote that, meet some of the needs. So also National Academy of Sciences, they had this workshop in 2019. So one of the things that came out at the end is this is promising and has a potential for transforming big data into environmental health research. What are the data that exists into knowledge? Hopefully we'll be able to use the SBI mechanism to help promote those things. So the way we would like to promote this is to have a funding mechanism where they will be able to come and develop ways to integrate the data sets that exist already. It could be being developed, it could be high throughput content data, and using the chemical features, and then a systematic review. We already kind of have a couple of grants in our portfolio in terms of SBR, so we would like to push more on those so they can, these can be automated, and then more information can be obtained from the publications. Other one is curating the legacy data. As we heard yesterday, there's a lot of challenges in terms of putting annotations and all those things. So hopefully they will be able to make them, they are interoperable. And then single cell molecular profiling is something where there's more research is being done using single cells. Hopefully those will translate into, in terms of the heterogeneity of the single cells or developmental changes. Those things can be captured, and then they can be used, the data can be used for further analysis and then interpretation. So with that, we'll also would like to encourage promoting developing algorithms or predictive toxicology assays, methods, and then hopefully they will incorporate some chemical structure activity relationships that will translate into identifying the molecular targets and mechanism how these kind of chemicals interact in the biological system. And then hopefully their goal is to be able to use this to identify the toxicity of the chemicals, estimating the exposures that we have, or understanding the gene-environmental interactions, identifying biomarkers, and then hopefully at some point doing some exposome analysis as well. So this also gives an opportunity to incorporating some epi studies. There already data exists that this can go into the databases and then can help improve prediction and identify some potential unknown toxics, or even potential there is a possibility of identifying some beneficial effects, especially with the drugs that can be repurposed for new uses, and then reduce or replace animals. And then the fact that this is meant for small businesses, this also help for promote more public-private partnerships. The third concept we're proposing here is for a biomonitoring, biomarker development for environmental health research. We have this topic in our omnibus for a long time, but one we see is one of the weaker portfolios. Similar to the engineering nanomaterials and educational RFA, which I shared with you earlier, we also would like to promote this through to a specific RFA so we can get this area gets stimulated so that we get more applications in this area. And what we like to do is identify, if there's already identified biomarkers, if somebody wanted to do more work on that, they can use it, the SBI mechanism to use that, to do that, and then these, hopefully they'll be more specific for the disease or exposure rather than a generic one, and then if more than one biomarker, they can identify it and use this, that'll be better, and then hopefully that can be objectively measured and adequately defined on exposure. And so this could be any of the biological processes that I listed here, and then it could be cellular, molecular, or tissue level, and then it could be circulating, including exosomes, and then it could be looking for oxidative stress, DNA damage, or mitochondrial perturbations, or it could be other things like inflammation, endocrine disruption, other things. So the biomonitoring, what we're kind of encouraging is developing point-of-care devices that are sensitive, that are compact, user-friendly, and low cost. That are probably non-invasive or minimally invasive. That also they can develop with the connectivity and exportability in terms of data that they collect. So this can be not only useful in terms of assessing at the personal level, but hopefully they can be useful in terms of use in a more epi studies as well. So that's the one thing. So hopefully they will use this blood, saliva, urine, or exhale breath as a medium to detect those things. So there could be biomonitoring and biomarker. These are two areas that we would like to focus on this particular funding announcement if its concept gets approved. The fourth concept we have is environmental exposure assessment sensor validation. So identify the exposures that that one may have, and then the goal is to promote broader use of the sensors, and then use them for both fundamental research and then epidemiological research. Hopefully they'll into translational knowledge. And so what we'll promote here is a kind of a phase 2B mechanism. We've been funding some of the technologies through our SBIR for some time for developing sensors, but what we are seeing is not all of them has really translated into products. One of the main reason we think that's possible is that a lot of our grantees, these are small business companies, are very small, like 10 employees or so, or even smaller. So what happens is once the SBIR money dries out, then what we call in the small business world valley of death. So they enter that when they don't have a motivation to further develop the technology, and then there's no other resources to develop these. So we would like to use this way to promote those technologies that are kind of already kind of almost prime, but not quite prime. So where they can do more studies like refining the sensor performance, and then do benchmark studies to see how well these sensors perform in terms of their function. And then if necessary, do some calibrations, because calibration is one thing that over a period of time, they can drift one way and then they might be as accurate as they were hoping for. And then also if necessary, they can go to EPA and get the product certified, so that gives more traction in the field when they develop this technology when they try to put it in the market. And then also usability protocol is important because they need to be used in the right way to get the actual right data. So they can develop that, so that with that they'll be able to take that to the field and then do some field studies or pilot studies, and then that way they can get some data that can publish, and then that will also give more traction in terms of putting the product in the market for broader use, either for personal use or for community use in terms of research. The other one we would like to do is also encourage more from academic institutions who have a protocol type of products that they would like to further develop, to encourage them to interact with small businesses and further develop their technology. This could be developing the sensor technology they already have, or it could be ways of analyzing or integrating data from personal public sources, or also developing some machine or statistical methods to further advance this knowledge. So on our overall, so SBI and STM mechanism provide a way to customize it to meet the federal needs. In our case, it's NAEHS R&D needs. So basically, I kind of highlighted here 4 different concepts. So developmental neurotoxicology is something, an area that we identified a need for that. And then artificial intelligence and machine learning is an area that's emerging. So we'd like to invest using the SBR money to use that way to promote that area for our community. And then biomarker and biomonitoring is an area that needs a focused approach to promote some new technologies that coming out of this. And then environmental sensor validation is something where an area that's unique to us in a way that the fact that we already invested money, we'd like to invest, put more money so that these can be translated into actual products that's broadly useful. So these are consistent with the important elements of the NIH strategic plan, especially theme 1, supporting development of novel cutting-edge research technologies which are high risk and high reward. And so this basically what SBR mechanism is always, it is a seed money basically to develop technologies. We know it's high risk, not all the seeds grow, but whatever grows, hopefully that'll give the reward. So this kind of gives a high-level information about how this will look like in the next 4 or 5 years. So we have some of the funding announcements that we need to re-release those which are approved in the previous concept clearance. And that, along with the ones that we're considering here, if we decide to put 2 RFAs roughly per year, and this is not need not necessarily need to be the order of announcements, so we can always change these, just to give an idea that this will keep us busy for the next 5 years. So with that, I would like to stop here and then acknowledge some of the help that we've been, like Liam, when we're developing the RFA on the educational RFA, and then Sri Nadathur on the nanomaterial RFA, and then David Balsha brainstorming on the sensor validation, and then Mamta Bell and DNTB team for their feedback and input on the neurotoxicology assays, and Nicole Kleinster and Charles Smith on the artificial intelligence machine learning. And also I'd like to thank my small business grantees. They ready to share some of the images that I was able to share with you today. And then some of them I took from a website like yours, Katrina's one, but others want to reach out to them, get permission. The fact that some of the small business, they develop proprietary technology, we want to make sure they are okay with it before we use some of these in the presentation. So with that, I would like to thank you all, and then if you have any questions or suggestions, especially updating our concepts, will be very helpful in terms of updating our omnibus topics as well, which we'll be updating in the next month. If you cannot do it today, we'll encourage you to look at it, and then if you have any feedback that we can use it to updating those in the next month or so, that's welcome as well. With that, I would like to stop here, and then the reviews are Dr. Shukme Ho and then Dr. Terence Kavanagh.
So Terry or Shukme, who would like to go first here? Terry, why don't you go first since I can
start out.
Oh, never mind. Yeah, Shukme, go ahead, please.
Okay, so we review this particular sections of SBIR NCTR programs, and they are just truly exceptional. And I want to congratulate Ravi, Dane, and Leroy, and Alfonso for doing such an excellent job over the years, and to promote like the translation of like funded basic and translational research and bring them to commercialization. This kind of program is really very important for this type of translation. The most impressive part of this is that you can see that there are many like small companies that were able to actually use the seed money and can start it, and eventually many of them actually turns into like sustainable larger companies. So I think that is going to be benefiting the community, the residents, the population, and also many of them can actually allow us to advance our EHS mission. So I think this is really central to the mission of NAEHS. The concept grants that the four particular concepts that we look at this round, developmental neurotoxicity, I think is very relevant. The one comment that I might have is that perhaps in addition to looking at developmental brain or developmental tissues, it might be worthy to extend it in the future with either this mechanism or others to the aging brain and the aging tissues. I think that's kind of really important for us to look at the demographic shifts towards the aging population. So I think that's important. The second, the biomarkers already we discussed a lot. We also really like the point of care devices, and because that way we can actually get results in a very fast way. And in fact, like for example, now people will even have ability to not have to test the sugar levels in a continuous manner. So that kind of technology is actually very useful. I particularly like the very forward-looking artificial intelligence and machine learning approach to advance EHS research, because this is where we have to take a lead, and we should be taking a lead in going forward and combining with all the other programs that is at NAEHS. So being able to predict, to look at a lot of chemicals, a lot of metabolites of the chemicals, and how they behave in the environment and also in our body with AI, with machine learning, deep learning. So these kind of things will help in the future. And also this will allow us to also look at sex differences, age differences, and kind of differences in windows.
Shukmay, are you still there? Because we don't hear you anymore.
Yeah.
Maybe you hit your mute.
Yeah, we can't. Shukmay? All right, I guess we're having another technical issue. So we'll put you on hold for a second, but Terry, can you pick up, and then if we get our audio back, we'll go back.
Okay. Thank you. Can you guys hear me? Yeah, okay. So I agree with what Shukmay said so far. I think that the developmental neurotoxicology program is in keeping, of course, with a lot of activities that are already going on in the division of the National Toxicology Program, and takes advantage of the substantial efforts that have already been made there. One thing I would say in addition that might be considered in that is potentially putting into the RFA aspects of the peripheral nervous system as well, and peripheral nervous system toxicology is an important area. From the point of view of number two, and continuing with the biomarkers work, the Institute has made substantial investments in biomarkers, and it continues to be, I think, an important area of development, and it's important to continue to especially invest in those areas that are related to the 3 R's, the organotypic models, for instance. And,
I don't know why the phone is being cut off.
And single cell molecular phenotyping. I think that those are really important areas. For the artificial intelligence and machine learning and sort of neural nets and using those kinds of things, I think that this is really another thing that's very consistent with the agency's efforts and investments in data science. And having commercial partners to work in that area is really important. For number four, again, continuing to support programs that you've already invested in to get them past this valley of death is really important. And I would just say also that one thing that you might do is to emphasize in the RFA the availability of support for intellectual property and patenting ideas and technologies, as well as enhancing capabilities and promoting their work through marketing and other means, social media, et cetera, and maybe even connecting to our PEPH program, because that seems to be a very a good avenue. I do note that there's some overlap between these different suggested emphasis areas, especially in the context of the data science and the 3D modeling, so that might be something. I don't know whether we can combine some of this stuff to have another approach, but there is some overlap there. It's not a bad thing, it's just that something to consider about how you organize the RFAs.
So let's, are you done?
So I'm highly supportive. Yeah.
Try one more time. Shukame, can you?
Hi,
Okay.
this is Shokme again. Back.
Please go ahead.
I'm highly supportive. I don't know which point my phone just cut me off. So, but that's okay. So I totally I'm highly supportive of this program. The only one thing that I do want to mention is that many of these products will eventually end up getting patents and intellectual property ownerships. So we already alluded to the fact that the funded PI needs to have U.S. citizenships or at least a permanent residency. But then when the patents are being applied, I mean, if one is going to apply for patent, I think we should really look closely into policy, not just for NAEHS, but overall, like how would those patents be viewed? And because we are in a very sensitive, phase of looking at foreign influences, and I just as a word of caution that basically maybe the agency should take another committee to take a look at this.
Okay, thank you. Are there any other questions? Ravi, did you want to respond?
Yeah, I just want to addressing the IP issue that you mentioned. So other thing that Congress recently authorized use for this, along with the small business program phase 1 and phase 2 is when they write the application, the applicants can ask for $6,500 for a phase 1 and up to $50,000 in the phase 2 for these kind of activities like IP, marketing, research, or bring some experts to give consultants into manufacturing, all those things. So this is something which just been authorized the last year. We're planning to promote more of that, so they can use when they put in the application, so they can ask for that extra money, so they can use that for those specific purposes.
Okay, thank you. Any other questions, feedback, comments? Yeah, Maureen, you have one?
Thank you for the presentation. I review many of these, and so I'm very supportive of it in general. My question is for those that don't go in that valley of death and with the seeds that are growing, how do we track the outcome of the products?
Yeah, that is a challenge that not only we have, but pretty much all even small business agency has that issue, because what happens is once the grant ends, there's no incentive for them to come back and say where the technology is. So it's a challenge for us to go and track the websites, and then we cannot reach out to them and ask them what happened to your technology unless they apply for another phase 1 or phase 2 grant. Sometimes they mention that in the application. But it is a challenge in a way that there's a whole community that we see that. So one thing that could be done, basically is the phase 2B program is kind of helping them to move that progress from a phase 1, phase 2. They haven't really done the technology in a way that's ready for commercialization. They can develop that. So, but it's a problem for the community as a whole.
But I think we shouldn't really give up. I mean, this is it's a good way to look at the return of investment, how to tailor your future RFAs, the things that you fund, the benefit to communities. So there is, I think it's, perhaps it's not really a responsibility in a way from a formal sense, but we want as an institute, that it's important to know what the return on investment is.
Lynn, before you go, I'm going to let Christy respond. Yeah, Christy's the chief of our program analysis branch, so.
How's that?
Not
Is
yet.
it working? Okay, great. So I just want to say, so we have our an internal system that we are actually, when we can get the information, we are collecting structured data for all of our programs, but certainly for the SBIR. So we have a lot of different specific tracking measures that we're interested in terms of the technology transfer, and Ravi helps us supply that data. We had a, how long ago? Someone who came in several years ago and did a concentrated effort, and so we took a lot of the metrics that she was tracking and put them all into hits. So we do have structured data. We're continuing to track those things, and you know, we collect it as we can. So we're absolutely doing that.
And that is, analysis of our programs is a high priority for us. Can I get Lynn first and then Jose?
It's funny, I was going to say something similar to what Maureen did, and that was very helpful. I realized that this program is a mandate, that, you know, that Congress sets aside a certain proportion of the NIH budget for these small business funding opportunities. And at the same time, it probably, if the program analysis branch has information, or if there's a way to have other information, I think it would be a good practice to now and then do, and I think that this committee might be interested in, you know, kind of an evaluation of which of these have actually produced, like especially the tech transfer, you know which technologies have been transferred to the government. You are the government. So I don't think you have to go to any secret sites to find that out, you know. And I think you can also find out if it's long enough ago if any of these technologies are actually on the market, because you could find out if they're actually being marketed. And I realize that when, you know, in the middle of some of these things you maybe don't know, but there probably are some of these approaches that are more effective than others in terms of actually resulting in technology that is marketed or transferred. And I did have a thought when I looked at these that they seem to be rather small funding opportunities. And, you know, I mean, are you better off funding a lot of small ones and shifting around as you are doing with a lot of topics, a couple of different topics every year, or would you get more bang for buck if you gave smaller numbers of larger funding opportunities out that then, you know, actually do produce technologies that go to market or come to the government? I can't answer that question because I've never seen kind of an overview of this. And I'm also wondering, does the NIH as a whole have a way of looking at this, since it is a requirement on every single institute to do these? It would be interesting to see, you know, which of these things really are benefiting small business in this country. I have no idea.
I think it's a great point before we go on to the other questions. So the question for Ravi is, we're not the only institute that issues SBIRs and STTRs. Are there best practices, either in the OD in Bethesda or amongst others?
Yeah, I was about to mention that. For example, I didn't go to the slides at the end, there are two slides where I kind of highlighted two success stories that came out of these RFAs, where they developed the technology and these products are commercially available. So based on that, we know that. So we're trying to get that kind of information. These companies, they develop the technology. They kind of, right now, one company already raised close to $4 million in private funding. So they got the very first grant from NAEHS. So now the company is from 2 employees to 12 employees. So the company is growing. So we know that that's a success story for itself, by itself, where they develop a technology. So NCI recently did a kind of analysis with their funding analysis, they outsourced for an agency to do that kind of thing. And within NIH, what we created is something called a seed office to do some of these things. So what the seed office right now is just they contracted to National Academy of Sciences to do this kind of a research to see how the funding that happened from NIH, how that transferred into technologies and products, and then they're trying to do that. So hopefully we'll have a report on that in the next year or so. But that covers the whole NIH. But when we met with some of the folks at the seed office, we kind of insisted the fact that EHS is kind of a specific in a way that it's not address a broader market, the economic benefit could be much more bigger than the actual commercial revenue generate. For example, somebody developing a kit for detecting a lead in water, they may not be selling thousands of kits of that, but then the one test what they do at one site, that may have a bigger economic impact in terms of hundreds of kids are not drinking that water and not getting an exposure because of that. So the economic benefit is a lot more than the actual benefit that the company in terms of they generate in terms of revenue. So that's something we don't know how to capture those kind of benefits. So that is a challenge we have now for our smaller community.
So Jose, you want next comment?
Just a quick question. My experience with SBIR is quite limited. I remember only doing one review in one session, and I think the question that I had at the time that I participated is a question that I still have these days. How do we know that one of these proposals come in is just Me Too technology with a small twist that is not really overly innovative and far and above from what the program is actually intended to do? And I remember asking that question, and is it a matter of the people that you bring in doing the reviews, or what mechanism do we have in place to determine that the folks that are funded are working on something that is really innovative, something that is very different, and something that is intended to do what they say those technologies are going to do?
Yeah, that's a challenge the committees have too. So, I mean, I have listened to debates between the reviewers too. Is it innovative or innovation? So they go back and forth. How much is that? And then, thing is, as long as it's been repurposed for a new use, and then it can provide some benefit, I think that's still, innovation. I myself worked in industry when so, for example, iPod is one example they give that. So where all the technology existed in that, and then what it happened was just they put together all the bits and pieces into one product that's a more successful product that been marketed. So that's always so it's not really innovative product, but it's just putting the bits and pieces together, making it to a broader use that's applicable.
Okay, any further comments before we call this for a vote? If not, I will ask for a motion to approve the concept that Ravi presented. So moved. Do I have a second?
So moved.
So moved. Okay. So further discussion? If not, please vote electronically. All right, I think we've done it here. So we're finished with our business. Before I turn it over to Rick, I want to say a couple of things here. Maureen started my closing remarks by thanking Liz. This process has a lot of moving parts, and without Liz, they would not move. So I also want to thank Rosemary Moody and Tina Powell for stationing the table outside, and thank the Nathan and John from NETI and Image Associates. Pardon? Yeah, I'm getting there, yeah. Yeah, sorry. And as well as the Convention Center staff. Our next meeting will be in a new venue, which will be the new auditorium, but at least we'll be back on home turf and won't have to take it on the road anymore. Thank Charles Lipford, who I'm not sure he's here or not, but he'll be glad to be back home, I'm sure. And I want to thank Ernie Hood, who is most often our science writer. He's the one that writes the great minutes that you look at and approve and I'm sure memorize every council round. And Bill Redd, who is the IT fellow who's been helping us, and he's outside and can't hear me. I also want to thank all the speakers today, DERT staff for what a great job they did, and thank you all for being such good participants today and yesterday. And I will turn it over to Rick.
Great. I see that the next agenda item is the adjournment. So before I pound the gavel to officially adjourn this meeting, first of all, I want to thank all of you for the careful preparation, coming into the meeting. And I'm actually pretty energized. I thought we've had some incredibly good interactions. You had lots of really good input. We've recorded your input, and we're going to take actions on this. So thanks all of you. And actually, Pat, I think you did a really good job. So for your first meeting here as the acting director of DERT, I think you deserve a round of applause. Okay, so with that, I will officially adjourn the meeting.